Organissima, New York. Your exotic skin, hair, and beauty source, and your one-stop shop for all your natural and organic skin and hair care, featuring authentic organic Moroccan oil and prickly pear seed oil and much more. Bringing you only the best, straight from the source and proudly produced in the USA. So what are you waiting for? Shop today at www.organissima.com. Organissima, New York. Your beauty is our duty.
Folks, welcome back to the Sales World channel, iHealth Radio, with your host, Hurricane H. New day, new show, not a new guest, a revisit from a friend, Tom Basey, with us today from Basey Insurance. And last time we had the general talk about Medicare and some Medicare products and service, who qualifies and things. Today we're going to have we did talk about that the last time, that we'll come back and discuss some more. And actually, we had a great exchange. A lot of people actually viewed the show, listened to it. They enjoyed it. And I was actually very impressed with Tom. Tom, I mean, we're in the same world. And from an insurance perspective, you did a great job the last time. So I am so happy to have you back. Welcome back, Tom.
Well, to your remarks, I had a great time. You're an expert in this stuff too. So yeah, it just worked very well. So I'm glad to be back again. We had fun, and I'm looking forward to our discussion today.
All right. Same here. Well, so last time we just talked general terms, Medicare, populations, who does that and the other. And, we kind of touched a little bit on the different, what's included and things. But today, I think, we can make that, maybe we can do a quick recap, and then we can go right into the different types of Medicare Advantage, MedSubs, maybe long-term care, veterans, and what covers veterans. Maybe we'll talk to TRICARE. This is your show. You're the expert when it comes to this, and I'll just have some fun with you. And we will hopefully enlighten some people and educate them about what's available to them. And finally, of course, anyone that works or lives in your service area would like them to reach out to you if they have any questions, and hopefully you'll be able to assist them in person to get whatever product that they need or they qualify for. Mm-hmm. So without any further time, let's just give some new viewers and listeners a little bit of background about you, and then we can get us back into the business.
Sure. I don't want to talk a lot about that because then we'll lose our visitor or our audience. But yeah, so I'm a second career person in Medicare. I've been doing this like 4 or 5 years now. I worked for many years as an engineer and a project manager in corporate America. But there's a great resignation going on right now. I just did it a few years earlier. Actually, I wanted to stop the commute. I wanted to not drive an hour one way, and I want to be able to set my own time, and I want to be entrepreneurial. So I was fortunate. We won't get into the whole genesis story of how I got into it, but fast forward 4 years, and now I'm an independent insurance broker. And so I appoint a lot of different carriers, but I just help people. I call it tailoring. So I like to just sit and visit with a person. And I'd like to think I'm unbiased because got a lot of different carriers. I don't care which carrier they go with. I don't care which solution they pick. I feel like my job is just to educate, explain to them how the different solutions work, and really which one should they go with. Sometimes they ask me, the one, sir, madam, you should go with is the one that you like the most, the one that feels most comfortable. So that's me in a nutshell.
Thank you. That was quick. That was a good one. A quick brief. But so I want to just to touch on one thing. That's an excellent point you made about you're not favored in one versus the other. All the carriers are the same. And really that's true. I guess salesmanship, 1, 2, it is the ideal scenario for audiences. If you are looking or listening, whether you qualify, you're a caregiver, or you're looking for information for your parents, grandparents, or friends, this could be a good element to discuss, because to your point, you have various carriers, you have various products, and depending on what the need is, you will be able to tailor whatever is available to them and to their needs. So it's not like you're biased. It's not like you're going to steer them one way or the other. So to assure everybody, that's one of the advantages of being a broker. You have the ability to sell different products. So you're not in a pressure of pushing one plan versus other. People get to choose. You just have to spread all that buffet menu in front of them and let them select. It's like a la carte business. Pick what's good for you. So I love that concept. And thank you for highlighting, because that's a big deal. And I think a lot of people sometimes get either annoyed or scared, or maybe even kind of not sure because they're skeptical because there's so many things going on in this world. Then people are not sure. Like, well, you have to be biased. You're selling this product, right? In your case, you sell multiple products, and whether Medicare Advantage, you have other lines, MedSubs or Medigap policies, and you have other things like long-term care policies. I think you might even do some life, if I'm not mistaken.
Yes, correct.
So you do a little bit of all. And so for folks listening, watching, I mean, these are things that you need. I mean, at a certain point of life, you have Medicare, you need options, and Tom can help you with those options. If you need long-term care, you need options, and Tom can help you with those, options. If you are a veteran, there are products that can work with your VA and your Medicare as well. So, Tom is an expert in all those things and can help. And so we talked general about licensing, about how to become brokers, career changes last time. We talked about the products and the Medicare in general. But so now let's talk about, the different types of Medicare that there are in terms of what's available to them, just as a summary, and then we can deep dive into specifics.
Okay. So number one, great point. I do like to clarify for everybody, Medicare by itself is really healthcare that you get from the federal government. So that is provided to you once you turn 65, or perhaps if you get disability, you get on earlier. But Part A and Part B are health insurance from the government. And Part A is hospitalization, approximately. It's an oversimplification, but I'll call it that. Part B is outpatient, doctor visits, testing, anything that's not done in the hospital. But you can get that from the government. You do have, typically Part A is already paid for when they're taking FICA tax out along with Social Security. Typically Part B, you have to pay for that. So many people starting Part B this year, and they're paying $170 a month for their Part B. So you get Medicare, and that's fine. It's created from the government. It's a red, white, and blue card and health insurance. There's a couple of challenges. It's not perfect. Number one, there's no medication coverage there. That's one shortcoming. And then number two, there's no out-of-pocket maximum. So God forbid, if you have to go to the hospital multiple times, the bills can kind of keep adding up and adding up. So what I spend a lot of my time doing is educating people. There's the traditional option. I'll call it option one. Get a Medicare supplement and add a drug plan. A Medicare supplement doesn't have drug coverage, so you need that supplement. You need a drug plan as well. And as the name implies, it supplements. That is, it pays for the stuff that Medicare doesn't, because there's like approximately $1,500 hospital deductible it'll pay. And there is a daily rates if you go to the hospital. And then there's Part B if you're going to the physician out there. There's a couple $100 deductible. So they've got all the major carriers, the health carriers that they'll offer these Medicare plan, supplement plans to help cover those out-of-pocket costs and or put an out-of-pocket max on it. That's great. And then, like I said, it doesn't cover medication, so you can get a drug plan. If you need to, you can get a drug plan from one carrier and the Medicare supplement from another carrier. That's one of the simplest example of tailoring. Often I'll do that because whether it's one medication or whatever the number is, 10 medications, sometimes depending on what I like to do is shop it. So I'll show someone different carriers and different retailers near them what their list of medication it costs. And so that's the way we do it. So that's option one. You need to understand it. There is a new alternative, and it gets a lot of play on the air, and it's polarizing. Some people really disparage Advantage plans. Some people love them. I think both sides are good. The traditional Medicare supplement, the Advantage plan. I just think you need to understand and pick whichever one works for you. Advantage plans, that's the thing. A lot of them, there's a lot of celebrities hawking them. And basically, I will contend that everything those celebrities say is largely true because it's a regulated industry. And so they will talk about potentially a $0 premium. Potentially, you can get one of those plans from a major carrier for $0 a month. And it'll have some dental, and it'll have some vision. It'll have the drug coverage included. It may or may not, depending on where you live, have transportation benefits or post-operation meal benefits, maybe a $0 gym membership. So they sound great. That's what they stopped the advertisement right there. Then they like to mention, however, if you go to the hospital, so it's not all $0. If you go to the hospital, maybe you'll pay $100, $200, $300 a day for the first 5 days or so in that. If you go to your a primary care physician, they're network-based, the Advantage plans, then it'll be a $0 copay. If you go to specialists, maybe it won't be a $0. Maybe you'll pay $30, $40. And so that's the thing. There are pros and cons. I won't dive deep unless you want to talk more about that. But that's, to me, option one versus option two that everybody needs to understand is, am I going to go the Medicare supplement plus drug plan, or am I going to do the Advantage plans? And there's pros and cons to each. Sit down with a professional, let them explain it to you, show which plans are available in your area. Then you can make your decision on that.
Thank you, Tom. That's pretty good. I mean, you did that's a very concise and comprehensive summary of a lot of different things that are available. So I just wanted to take a minute just to kind of break down a couple. So one of the things you mentioned about the Medicare supplements, that's actually, to your point, just the cost of things that you will have to pay in general, your copays, your coinsurance. Also, it's something you mentioned about the it's not covering Medicare, for example, it's not covering dental and vision or hearing and whatever. So that's actually important to know that that's something that you still have to buy on the side, whether you buy a separate policy. And I think you can help with that as well. And then to your point, also the Part D, which is the drug piece, is something else that you have to have in the carrier. And there's cost to all of these things. And then you mentioned briefly the concept of Medicare Advantage, which for the most part, there are zero premium plans. But again, the way it works is very simple. If there's a premium, there's low copays. If there's no premium, there's high copays. So that's how you take what's good for you based on your health needs at the time. Because I mean, today I'm be healthy. I may not be needing a hospitalization. So maybe I'll take a zero premium and not worried about the hospital. But if I am actually more frail, I might want that just one in a policy where I pay something, but I can go to the hospital without having to worry. And to your point, you mentioned something about the regular original Medicare. We have a deductible of $1,500 or so. And then if you have a Medicare Advantage plan, you'll have to pay day to day. Typically, a hospitalization is about 3 days. That's just the average. And then you usually go to some sort of rehab, and then you don't pay for the 20 days, whatever after that. Most of the plans do that. But then to your point, at that point, then the numbers will start, either moving one way or the other. If you go 3 days and it's 300 days, not 100, you're still ahead of the game. But if you get into 6-7 days somehow because your case is worse, now you have. Now, one thing is on the Medicare Advantage, you do have maximum out of pockets for medical. Yes. So that includes that. So there is a somehow something like almost a fail safe. So if you really are bad and you have some catastrophic, scenario, well, you do have the maximum you will ever pay on an annual basis, which eventually at the beginning of that year, you would know what's the worst case for you. And then you can gauge whether that makes sense or not. So I just wanted to clarify those, because again, for some people that maybe for the first time hearing the show, they'll be like, whoa, that's too fast. Too many things going on here. But the fact is you have options. Thank you, Tom, for saying that. You have your basic Medicare or original Medicare. You can add that to your point with a carrier with a Part D and a MedSup. And the MedSups are regulated too. So they're basically standardized throughout the nation. Doesn't matter where you are. There's like an alphabet, series, and you pick one that makes the most sense. But to your point, for the most part, it's not benefit driven, it's cost driven. So I just wanted to kind of highlight those things, and you're still the expert, by the way.
You too. Keep going. This is wonderful. We're providing value to your listeners. What else?
Yes, yeah. I love this exchange. So this is good. As a matter of fact, I literally a couple of weeks ago I had some questions that are similar, and most those are the things that people ask. What are my options? What will it cost me? What will I do? What happens? How does it work? Can I get something else? Now that gets us into other things. Like to your point, before we started the show, we talked about what we're discussing today in terms of additional types of plans. And within the Medicare Advantage, there are there's a level of things, right? There is what we call the pretty much all MAPDs. They all kind of have for the most part, there is with the drugs only, or medical and drugs combined. So MAPD, PDP, or MA plans, and that's just acronyms that we refer to in general. However, you mentioned something about the managed care concept or the Med Advantage. One thing we didn't talk about today, and just to clarify, one of the main differentiators when you join these plans is that you have to, if you're on a health maintenance organization level, then therefore you actually have to be in a network. And so depending on your primary care doctors and specialists, if they're there or not there, that's important for a choice for decision making. If not, you can choose what we call a PPO, where you have access to, our network, and you can have access to any provider. On the flip side, when you talked about just original Medicare with MedSups, it gives you flexibility to go to any provider that takes Medicare rather, and you give them basically a Medicare card and your MedSup card, and you're good to go, like ARP, whatever. So that just to clarify that. But then now we're talking about, in addition to your standard MAPD, MA, or PDP, and those two, people sometimes have Medicaid, right? And what other options would people have, or what other Med Advantage people can be on, depending on their needs and health?
Well, so you mentioned a big one, so I'm going to talk about that one. Medicare and Medicaid. Number one, people get those two confused sometimes. I think I'll just make a couple of remarks about that. So number one, Medicare, as the name implies, it's care that is health care. That's health insurance from the government. Medicaid, it's aid. It's like help that's financial help. And although it may be funded partially at the federal level, it is often funded and or administered at the state level. So what happens is someone is potentially on both Medicare and Medicaid. If they are on both of those, then there's a subset of plans in the Medicare Advantage world called dual special needs plans. We call them DSNP. Dual is in both Medicare and Medicaid. If they are on those, there's some real feature-rich Advantage plans. So where a standard Advantage plan in a given zip code will potentially have some hearing coverage, some, and it's largely going to be at $0 cost of preventative stuff. As you can probably get some preventative dental, maybe some preventative hearing and vision, annual testing, that kind of stuff. But then if you're duals, that you'll have a feature-rich plan. So my point is, instead of having maybe $1,000 or $2,000 worth of dental, someone is on dual Medicare, Medicaid, they may have $5,000 in, and it will potentially cover dentures. Typically, under standard advantage plan, dentures, for example, aren't covered. So sometimes I call them supercharged. And so you may have an over-the-counter credit on a standard advantage plan, call it 30, 40, 50, 70 bucks every quarter, where you can buy some over-the-counter stuff from a pharmacy or potentially a product catalog, but you can get Band-Aids or antidigestive, aspirin, that kind of stuff. If you're on dual, these plans are supercharged, and so you can get sometimes a fresh food card. Sometimes it's $100 or more a month. So they're like advantage plans. They are in fact advantage plans, but because those people are in financial dire straits, and people qualify basically below the poverty level, the advantage plans are supercharged. They have some real feature-rich benefits, like I say, and typically their copays are going to be zero, and often Medicaid is going to subsidize that. So they are very cost-effective healthcare solutions for people that are on dual plans.
Well, thank you, Tom. But just to add one more thing. So for the people on the Medicaid world, depends on their level of low income subsidy, as we call it, which basically qualifies them to what level they of Medicaid they have. That can determine also, to your point, 0 or maybe up to 20% coinsurance. But for the most part, to your point, anyone that is pure 100% Medicaid, they will not pay anything. First of all, I want to just clarify something for the audiences and anyone watching. There is no such thing as a free thing. So in this world, there's no cost to you. There's a cost somewhere. It is subsidized by one of the government, agencies or both. And then also the plans basically manage that. But there is no such thing as a free thing here. So just to clarify, like when we talk about these things, say there's no premium, whatever, that doesn't mean it's free. It's just not to you. It is at no cost to you or low cost, but somebody is paying for it. So that's usually coming up like, well, is that, what does that mean? There's no premium. Does that mean it's free? No, it's not free. So let's be clear about that. So you kind of define the dual, product. Now, within the dual, that's to your point, and I love the way you did it. You have the Medicare piece, which is the care, which is what you actually paid for through FICA through your Part A, and then your Part B that you buy in. I did want to ask one question that comes up all the time. Now, what happens if someone, let's say, at the time they turn 65 and they don't want to select the Part B for whatever, they still work, they have spousal stuff. What happens in that case? What choices do they have, and will they lose the Part B? Will they have the opportunity to go back to it later? And is there any penalty for that?
So that's a great question. There's so many different scenarios. You're going to exceed my expertise eventually, but what I would offer is, when you first turn 65, there's this open enrollment period, and they don't ask a lot of questions. You can enroll and start those things for various reasons. One being, particularly if you're going to continue to work and you like the healthcare coverage, some people will wait. In other words, you don't have to do that right away. But what happens is, if you go, I'm going to use that scenario as kind of, because it's the one I encounter most often. Somebody works 5 more years, they go to 70. Now they say, you know what, I'm going to go ahead, either because they're going to retire or because they've kind of decided, for one thing, their healthcare insurance costs are likely going up. So often people will save money by eventually getting over. So for whatever reason, they decided, I'm going to switch over. It's been 5 years. Actually, they can go ahead and apply. They say, I'm retiring, but now they're going to ask a little bit more questions. And what I mean is, now they want to ensure that you've had credible coverage. And the reason they do is because what they don't want, insurance is built this way. Everybody contributes and pays monthly premium. And that way the insurance companies can afford to pay people. So what they can't afford is for everybody to wait until the day they need insurance and then sign up for it. And so you're incentivized to join. And so the point is, there is a penalty for it. And so so when you apply at age 70, you're going to submit an additional form, evidence of credible coverage. You're going to need somebody to implore to sign it and say, you were covered. You'd had health insurance, for example, these past years. Let's say it's ending September 30th and October 1, you're retired. And when you do that, then there will be no penalty. Conversely, if somehow maybe you retired, but you didn't want to turn on Part B, but you didn't want to pay the $170, whatever it is. If you retired and you decide 4 or 5, I better go ahead and get some insurance, I'm getting on in years, then there will be a penalty for that. So there are penalties for that. I'll stop there in the event you want to elaborate, or there's a separate penalty kind of for Part D, the drug as well. But let me just stop there. So I've responded to the first part. You feel free to remark on that or guide the conversation.
No, thank you, Tom. And just to clarify, when you mentioned something about somebody who's choosing not to take it once they are not anymore with credible coverage, that's when the penalty, exercises itself. But also, you mentioned something about, well, I just don't want to pay the $170, the Part B. Let's be clear. if you don't pay for it, eventually there's a penalty, as you mentioned.
Mm-hmm.
But also that is going to be automatically deducted from your Social Security check. So technically, it's prepaid. It's like another tax on yourself. So you continue paying your Part B, whatever you want. But if you choose to defer it to a later on date without any credible coverage, which means you just didn't want to pay, you're going to have whatever penalty that they're going to charge you. And that's for life, whatever, the rest of your life. Now, the other thing is I want to just elaborate, you basically, let's say you become eligible in one of the year, but then your coverage begins sometimes in the summer. So there's different time frames for those things. So you have to be clear about these elements, and you have to ask for these things, specifically when you are at that age of Medicare. And if you're working or not working, make those choices. Don't make the choice without knowing. Find someone who actually is an expert, a benefit advisor. Ask about your options. You can also request information from Social Security. Another resource that if you are Medicare, age and you're getting into it, you're going to get what they refer to as the Medicare and You book. It's an annual. It's like literally the Bible, for better words, for Medicare. If you have it, you know everything about Medicare that you need, and it's a good comprehensive package. What's covered, what's not covered, your election period, your options, and who pays for what, and so on and so forth. So it's a good book. You can download it if you are on a computer, or you can order it. You can go to any local Social Security office and get one of those. We use it for our seniors. We also use it in training. It's a great book, and it helps. If you learn that, if you read that book, you understand everything. It's like a reference book for everything. But like I said, ask an expert to see what your options and what. The last thing you want is to go without asking, and then you'll discover that you have to pay extra now, and it is not something that you just pay one time. It's going to continue tack on into your regular Part B premium, and to your point, also the Part D if you choose not to pick it up, whatever. So again, you can have it. I mean, to your point, sometimes you can be working, but the cost of that is going to be more. So then why not? Just get your Medicare and be good. Sometimes people choose to have a spousal, insurance, and then they'll continue. But the minute that is, you also have a limited time from the time you don't have that coverage, and I believe it's 2 months. If you skip that, then you basically at loss. So don't make that mistake, folks. Just do your thing. Do yourself a favor. Always ask, and that's what, again, these shows are dedicated to these things, to help you at least identify and then ask the questions. There's plenty of places you can get these things. You can online, forget about it. Medicare and .gov has plenty of resources as well for people that need the help. But one thing that Medicare is not going to give you, I mean, you can enroll online with them. So they have actually this site where you can compare plans automatically and just enroll. What I've noticed, most of the people that do that enrollment there, they have some sort of a gap in their enrollment, and therefore they need more help after they submit their, forms. Just basic example, they don't pick up a doctor, and now they need somebody to help them and assist them with the selection of PCP. They find out that the PCP is not there, and now we have a problem. A drug is not covered. So again, you have options, but know what needs to be done. It's always good to look at that, see what you want, then maybe consult with an expert such as Tom. And then basically at that point, you can have both of our worlds, and you can make an informed decision, and you don't make a mistake, and then you're happy. The other thing is, that you are going to be locked in some periods of time, depends on the type of coverage you have. So we're talking about just standard Medicare without a Medicaid. Then basically you have an annual time. You mentioned something about the annual election period, or AEP, which is usually October 15th to December 7th. So that's your main annual, time where you can make a move. There is a secondary movement you can make now from January 1st to March 31st. And that's the secondary, or we call open enrollment. If you choose a plan and you get to test it January, February, you don't like it, you can move out of that plan again. So again, you have options, but you will not know unless you hear a show, for example, or ask an expert. So please do your due diligence. You have plenty of time before Medicare age. You have 3 months in advance, that you can start doing the work, and you can apply as early as 3 months before your birthday. So there's some things that you can do, but just don't go blind until, and by the way, you're not going to get automated stuff. Like, to your point, you have to apply for the Part B and stuff. Don't expect that it's just going to happen. Like, oh, what happened? I didn't get my card. What did you apply? That's a big question. And I've seen that happen when someone thinks it's happening automatically, and they just expect it to happen, and they have it, they receive it, but nothing happens. And then before you know it, they missed all their deadlines. Now they're actually, to your point, on the penalty, realm, which we don't want to do that. So again, if you're watching this, you are obviously looking at Medicare or Medicare expertise. This is good information here that can help you. So Tom, you mentioned the duals, and so that's just the general population duals. But there's other ways of being on some sort of a special needs plan. And what are some of the forms of special needs and who's qualified for them?
So another one I will mention is CSNP, Chronic Special Needs Plan. As that name implies, chronic implication is you're not going to get over something, you're just going to manage that. And so some examples might come to mind: diabetes or heart disease, that thing. So there's certain conditions that occur. And so what happens on those plans, not unlike the dual plans, they're designed to help that subpopulation. And so, for example, you're going to get, I'll just use diabetes, you're going to get some very cost-effective either sources for insulin or synthetics or whatever, pump dialysis, insulin pumps, whatever. So they are plan specific to, and the thing is on those plans, so you may even be on a regular Advantage plan. If you get the diagnosis in the middle of the year, we're kind of talking about AEP and OEP. Actually, there's a special enrollment period, SEP. If you get the diagnosis, now it's going to require a healthcare provider to sign a one page that says, yes, you've been diagnosed with this heart disease or with that, but you can get on one of those plans. And those plans are simply a variation of a Medicare Advantage plan, and they're designed to help with the management of the disease. And so so one, you can get on it in the middle of the year. You're not worried about you don't have to wait till the enrollment period, and they're going to help you manage that by cost-effective solutions on the medications or the durable equipment or that kind of thing. That's what I'd mark about that. I would like to say one thing real quick before we get too far away, because your audience, you always have diversity. You never know who was on here. HMO versus PPO in the event. So Medicare supplement, there is no network implications. Anywhere that Medicare is taken, you can then take your Medicare supplement. So if you can go across state lines. If you're going to spend summers in another state, you can do that. The Advantage plans are typically network-based, but what I wanted to say briefly was HMO, Health Manager Organization, PPO, Preferred Provider Organization. My point is H, think of H as like have to, and P is like preferred. That is, if you're on an HMO, you have to see in-network care if you want them to pay for it. I mean, you can go to whatever doctor you want, but it's not going to be covered. And so if the person that did both your knee surgeries, orthopedic guy, if he doesn't even take Medicare, then you can't go to him in an HMO. Now, if you get the PPO version, then you'll pay. There's higher rates for out of network. So it's preferred you go in network and you get the lowest rates on your plan. If you get the PPO, then you can go out of network. It's going to cost more. Now, having said that, you talked about the out-of-pocket max. So I'm going to make up some numbers there. I think they're order of magnitude reasonable. You might be able to get in an HMO, and the annual out-of-pocket maximum may be about $4,000. So if you have a long extended hospital stay, at least if you have that out-of-pocket max that year, you're not going to exceed that. In fact, if you went to the hospital the next time, maybe it's locked in. So that's what I love about Advantage plans. So as a minimum, get them to lock that in instead of just writing just plain Medicare, and to cover that part, the drug penalty. You can sign up, if you can sign up for a $0 Advantage plan, you're fixing those two main things I mentioned, the out-of-pocket max and your drug coverage. You can go to the PPO, but they are going to charge you more for the flexibility. That PPO, one, you don't have to get a referral. Some of them are kind of open, but as a general rule, if you want to go to a specialist, you might go to your primary first and then get a referral, which is good, I guess, to make sure they're in network. And you can go to those, but then you're going to have maybe double or triple the out-of-pocket max. So for the flexibility on the PPO, it's going to cost you maybe $8,000, $12,000 out-of-pocket max to do it. So I think it's important to know that. So we covered D SNPs and C SNPs. Okay. Was I missing? And the main thing I'll say is, so here's the other thing. I'm just trying to catch up on a few things. So there's a penalty, yes, if you don't have drug coverage. In other words, they don't want you to wait 5 years and then get diagnosed and get a very expensive medication prescribed to you. And then, I'm going to jump and get a drug plan now. So they want everybody joining right away. And so my point is, at least if you sign up for an Advantage plan, then you've got that covered. You sign up for $0 and you've got some kind of drug coverage there. And as you said, the penalty is for life. And so I'm going to see if I can articulate this both accurately and easy to digest. The penalty, I believe, for every month that you wait and you don't do it. So in other words, what if you only waited 6 months and then you went and got the Advantage plan? I think it's 1% of the cost of the average drug plan in your area per each month you do that. So I'm going to make up numbers. So if the average drug plan cost is $30, well, then if you went 10 months, that's 1% each month, and that'd be 10%. 10% of $30 is $3. So in other words, if you wait 10 months, then for the rest of your life, you'll get this penalty of $3. So your $0 Advantage plan is now costing you $3 if you're effective. So I just kind of want to say that. So let me stop there, okay? But I wanted to kind of get some of those things in.
No, I appreciate it. Thank you. And you mentioned something powerful about the ability to cross lines, state lines. Mm-hmm. And you're right. So on the HMO level, you're very restricted to the network of providers that is I don't know. There are a few plans that might offer under their HMO, business, some sort of a, like in our case in the East Coast, North, we have what we call snowbirds. So they give you, there are a few plans, nationals, that actually do offer an option. If you actually move to, let's say, to Florida for a few months, they give you extended coverage because they do have a network there. But that's a limited pool. To your point, as a PPO, usually it's a network, you can go anywhere. But to your point earlier, which is the MedSup or Medigap policies, that's basically your Medicare, and that you can go anywhere nationally and you won't have a problem. So again, depends on your condition. By the way, these things can shift. And you can change things all the time, year to year, depends on your needs. And the other part is, one thing you cannot do is combine those. So Medigap or MedSup policies and Med Advantage cannot be together. You can only have one or the other. It's unfortunate, but it's a super thing that, one, kind of compensate for the other. Again, one is cost-based and flexibility. The other one gives you potentially flexibility and much better cost and a lot more advantages in terms of the benefits you get. So those are some of the things. But again, you have to see. And one of the best things that we do, and we're supposed to be doing as insurance benefit advisors, is that we have to always assess your needs, ask the right questions, see where you stand today, what you need. We don't ask health conditions, so this is not like life when you have to actually get a medical, physical before you can get, approved. But we do have to know, for example, if you have a primary doctor or a specialist, whatever, so we can determine which plan has the doctor. Now, if you live in a metropolitan area, there's a good chance that everything is, condensed enough. Most of these HMOs have pretty much almost every doctor. But when you live in more suburban areas and rural, you're going to have less of that. So the PPO option is usually something that you want. And again, there's premiums versus no premiums. You also have to look at that. If you have enough. Now, if somebody who can pay, let's say, $150 a month and get, the advantages of whatever that plan is offering and save, let's say, good example. I'm gonna use your example when you give some numbers. If you have, let's say, a specialty, let's say you're diabetic, and we're not talking about CSNP here, we're talking about just a regular Med Advantage. You happen to have some drugs that are costly and they're recurring, and you have to see a specialist twice a month. It's, let's say, $40 a specialist, so that's $80. And there's a plan that gives you $50 premium, but $15. So you add the numbers and then you see whether that plan makes sense or not. So again, you have to add it up, dollars and cents, literally, to see what you get from what your opportunity is. And then that's it. You did a great example with the Part D. If you're going to pay $0 and then now pay $3 every month extra, why? And you can have that from day one and don't lose anything. By the way, if you don't use your coverage, nobody's going to complain. Just know this, you have it. When you need it, it's going to be there. Now, another thing on Medicare Advantage that I would just want to highlight is the word Medicare Advantage not only is giving you the extra, but also there's a whole managed care concept behind it. So you have teams of, folks that can help you. If you're straight up Medicare, original Medicare and MedSup policies, well, that's just basically a credit card for your health. So you can pay, but there's no management, team, a health management team or healthcare managers that are going to be dedicated to you. When you join one of those plans, whether PPO or HMO, you're going to have a dedicated team of nurses, and even some plans have physicians within the plan, medical directors that actually can agree, disagree, authorize, and things like that, and give you some special, access to certain things that you might need. Ultimately, the plan is an insurance company. Yes, most of them are for profit and they want to make profit, but understand something, that they get subsidized, they get paid by the government, and they have X amount of dollars that have to maintain your health, accurately and give you the best they can. There are a lot of metrics. The Center for Medicare and Medicare Services is really the government agency that regulates, but also that pays for these things. So therefore, it's a federal, finance, and there's so much scrutiny and there's so many things. All these plans have star ratings. And these star measures are very, very difficult to meet. And you have to actually really be as good as you can be to actually reach the higher your star level. The higher you have as a health plan, you can do more. But then the reason I'm mentioning this is that these plans have to work hard towards your healthcare. There's preventative things that they actually put in place. If some plans have diabetes, things they want you to see your doctor. If you're a lady, they want you to do your mammograms, your pap smears, all the stuff. So they want all these. If you're at a certain age, prostate, examinations, they even have incentive for these doctors sometimes that participate to help to make sure that you get the care you need. So I understand that you have a dedicated clinical team, and some plans even have social teams, social workers teams that help you in different, reasonings, to help you through your health, so you don't have to sometimes. And we're going to get this will probably get us a good segue to the long-term care piece. But if you need more, some of these plans can offer these options for you that we're going to talk about in a second here. And then that can even give you more enhancement to your, house, whatever you need, maybe handicap access, whatever. So the point I'm trying to make is that you have so many options and they're all geared towards your need and care. And there's so much regulation behind it that you should be happy. You cannot be messed up with. Let's be clear. However, education is key. Make sure you know what you're signing up for. You don't just sign up for things without understanding what your agents out there. Make sure you actually give the right information. Don't just kind of skim things around, and people actually are misrepresented or misunderstanding things. And then they think, oh, I thought I'm just, like you mentioned something about over the counter, drugs and vitamins and things. So that's a big thing with the dual. So the people, you have Medicare and Medicaid, you get this advantage piece. And now guess what? You have $150 a month worth of vitamins and Tylenol and even toothpaste. And then to your point today, now even food, you can get a food allowance every month. You can go to a local Stop and Shop or whatever and be able to, or Winn-Dixie's, whatever, and go in. I don't know if Winn-Dixie is still in Florida these days.
Not certain.
All right. So you go to one of those, places and you actually get, up to whatever that allowance. So there's plenty of things, but understand, don't sign up just for things because it's going to be as a carrot to you. Make sure that everything else is in line with your needs, because that's the biggest problem we encounter as health plans is that, the representatives telling one thing, the member has different expectation, they go somewhere. The doctor may also be like, well, I don't like this plan. That's another thing that happens sometimes. Why did you sign up for this? You need to move to this plan. They're not supposed to do that. But as a doctor, they care about you primarily, but also sometimes if they're not going to get you mentioned something about referrals and authorizations. Some plans have ease of these processes and some others can be more difficult. So doctors don't want to be spending 2 hours to just get an authorization for you in a process. So therefore they might just ask you to eventually change the plan. So again, ask for these things as you are talking to your agent. Make sure your broker, make sure you have the right questions. And so I'm purposely putting those up. So if you're listening, take notes and then ask those questions. And by the way, there's a lot of resources in there what to ask, for. And then if you get all these things and you understand them, and if you're not clear yourself, maybe your children, your caregivers are available with you. Have someone representative with you that may be more able to ask the right questions and get from you. So again, not to scare folks. It's a smooth transition. It's an easy process, but there's just so many, options for you and so many things that you need to know before you make that signature on that dotted line and join the plan. That was me. So now let's talk about the other forms of Advantage plans. Okay.
So another one that comes to mind is specific for veterans. Okay. So you were talking about MAPD. Well, MA. And so I'm not going to mention carrier names, although I love the major carriers. As a general, there's people who hate them. There's always going to be someone who hates them. But as a general, these big companies, they're big for a reason. As a general, they take care of people, and actually they have a brand to protect. So I find they largely do. They want to get the 5-star. So they try to behave themselves. They try to serve people well, both the beneficiaries and the agents. So I actually like those carriers. What I would offer is, rather than say their names, I'm going to say there's an MA plan to support veterans. One of them is called Patriot. One is called Honor. One is called Eagle. And they name these plans, these things. And these plans are a form of Advantage plans, and they're designed to play well with TRICARE and or TRICARE for life. And the veterans folks will know that's their health insurance stuff they get. And they're not all the same. There's variations on it. I won't get into the details of CHAMP and CHAMP for life, kind of if you're the spouse of a permanently disabled or someone lost life in duty. But bottom line is, the good news is these same carriers that provide these $0 plans to a lot of people, if you're a veteran and sitting around and you have Advantage envy because you see the stuff on TV and you go, I'd like that, there are some plans available, and I would encourage you to look for those. And so what I would offer is you can keep your VA TRICARE stuff. You can potentially sign up for one of those plans. It'll potentially, like the other ones, be $0, and then you'll get some of those benefits. For one thing, you don't have to go to the VA for a dental service. Maybe you can go to a dentist in your area. Maybe you can get the $0 gym. You don't have to go to the PX. And so there are plans that are available. And I like the fact, we need to take care of our veterans. So I like the fact these carriers are doing that. So even though you have TRICARE for life and you're a veteran, you can get some of these plans. As a general, they don't have the prescription included. You'll continue to get that from the VA, for example. But there are plans that are, let me see if there's anything else. Oh, another thing, here's another thing. There are plans that do this that aren't veterans, but I like to remark about it here. And that's the much sought after Part B give back. People hear about that. So some plans give this, and I like that they do this for veterans. And sometimes you can find a plan in your neighborhood, even if you're not a veteran, MAPD that have this. And as the name implies, so you're paying, let's say for discussion this year, if you're paying $170 a month for your Part B, some of these plans, and like I say, if you're a veteran and you find one that does it for you, I like it. They'll give you $50 back or something on that. I like that. So there's a financial thank you, I would say. So I like to mention that. Let me stop there, Hurricane. Is there something else you want to ask or talk about that, or want to remark on those?
No, I appreciate it. Thank you. As a matter of fact, I was hoping that you would mention something about that part, the give back, because that's a big deal, and some plans do offer it. But one thing you mentioned, very important when it comes to the VA, folks, and the TRICARE. This is a question that comes up all the time. Well, if I have the VA business, why do I have to get into something else? Well, you have Medicare, you have Medicaid, or both, or depends what your status is. Bottom line is, many people can still continue getting their care on the VA, administration, go to hospital, whatever. But sometimes, again, this came up recently and for you last couple of years where there's long waits and things like that. Instead of waiting for that, you can still have access to the stuff. So you're not losing anything. It's a win-win. You have both. That's the advantage. So take that for what it's worth. Just have both. Listen, it doesn't hurt to have more.
Right.
If it's available to you, take it, keep it. Don't use it if you don't have to. No worries but when you need it, now you have something to fall back to and you will never have an issue. So just, again, if you're a veteran or your family of a veteran person, know that there's options, again, with their Medicare. And sometimes you can even have Medicaid, Medicare, and have your VA. Why not? Take them all. You've somehow paid something. If some people say, well, Medicaid is kind of government and, you take in them. Well, some people paid their taxes for their life. They have a bad patch of, a year or two. They lost their job. Guess what? I mean, it's who it's for, really, right?
Mm-hmm.
And we're not talking about people that may take advantage of that. That's a whole different conversation we can have, and the insurance fraud and waste and abuse and all that. But that's a different subject for a different day. But really understand that this is something that you work your life, 30 years, whatever, and all of a sudden you have 2 years of no income, whatever, something happens, your company laid you off, whatever, and you can't get back into whatever status you had. You might be needing some health coverage. It's not welfare. That's another thing, just to be clear. Welfare is a broader, terminology. And, some people often kind of put those together in the same bucket. While if you're on welfare, you can qualify for Medicaid, doesn't mean that you're Medicaid, you're a welfare, recipient. So again, some just clarifications that typically people kind of frown upon and they get excited about. So I just wanted to clear that as well. Now, you mentioned the CSNPs. We talked about DSNPs. We talked about the TRICARE, VA, and options. What about iSNPs? Now, again, we're talking about codes here. So iSNPs is institutional. Yeah.
But I really, candidly, I don't have a lot more to offer on those. I have not done a lot of those plans. I recognize those exist, but I don't want to go down that road a lot and talk more. But what I would offer is not unlike that. So those are designed for people who are in institutions, for example. And so if you're living in a nursing home and your care comes through there, but I personally don't do those. I would encourage you to make some remarks for the listeners. I don't have a lot on that.
I think you covered it all. That, as the word says, it's if you're going to live in an institution and you can pick one of those plans and they have the benefits that will satisfy you while you live in those residences. So it's a little bit of a different. It is and the Medicare and stuff, but again, same way the CSNPs covering your diabetes, your cardio, or maybe like HIV. Those are some of the common ones. But in this case, if you are in the institution, this plan will provide you for those things, and so therefore it will be just for you being within an actual premise of one of those facilities. So again, that's the other one. So again, these are just varieties of different options that you have. So depending on your need, you can be on Medicare Advantage, you said, and your diabetes becomes crazy. And there is a plan in your area that is specializing in diabetes, special needs, then you can switch to that plan and get the best for it, right? Still get all the care, but you're going to be enhanced basically on your diabetes needs. Again, I mentioned HIV. They have plans that are specific to HIV, patients, and therefore they actually get the best care that's available to them in that area. So those are things. Now, earlier, you and I think we mentioned long-term care. So let's talk about that. Now, long-term care, there's two levels. There is the private insurance long-term care, and there's the government long-term care, or managed care long-term care. So we can talk about those. So how does that work for someone, Medicare, Medicaid, or not, neither? Or
well, I like to do a couple of things. Number one, I want to make this is this part of the show where I like to throw out some stats and even some definitions, because for one thing, some people think Medicare is going to cover their long-term care needs. So I want to talk about what long-term care is. So we've kind of transitioned. So when you talked about institutional and then Medicare, so Medicare, it is Medicare, it's medical care. So although some Advantage plans actually have a $0 home health care benefit, the implication is someone's coming to your home and doing something medical for you, changing a wound or something like that. And sometimes you can get that covered at no cost. But long-term care, here's where I want to share these stats. I think I'm going to say 75% of the people, that 75 or 80, this can vary year to year, but the number I'm going to use right now is 75% of the people that turn 65 are going to need some form of long-term care. So I want to talk about what that means. But one of my point is, well, most of us are going to need long-term care. Gender-wise, it varies a little bit. Typically, once a guy gets into long-term care, he only uses it for less than 3 years. A lady will use it 3 to 4 years. So there's a slight difference there. But what is long-term care? That is, number one, you can either qualify, like if in the insurance world we say for cognitive impairment, Alzheimer's, for whatever reason, you can't be left alone. Well, then you can qualify for long-term care benefits. Or if you can no longer do 2 of the 6 activities of daily living, which are eating and bathing and grooming, toileting, transferring is getting out of the bed to a chair or moving, and then continence. Once you can't do those, you can qualify. So if a healthcare professional will sign it, then you qualify for that. And the other thing I want to share with you is, unfortunately, a lot of times it is a family member that's going to take care of the people. Sometimes if they don't go to an institution, there's a whole spectrum of care. But in other words, even if it's someone at home, and those people are going to lose income potentially if they have to spend time. So it's a challenge. So my message is, a lot of people are going to need this. And so to me, it's a passion. It's not unlike life insurance. Most people recognize, yeah, I'd have some life insurance. If I die prematurely, I want to leave something to take care of a spouse or raise me. Man, you really ought to consider long-term care because it's likely you're going to need that. And if you don't, let's say you've saved up and you've got a nice pile of money, an estate you're going to leave to family, the cost of care, you can look at this online. They've got numbers, you can look at it regionally. It's like $7,000 a month on average nationwide, the cost of a long-term plan. So me personally, I've got a long-term care plan, and it is for a dollar amount. And I bought it while I'm in my 50s still. The older you get, the rates get really high. So the younger you are, get in there. And I designed mine at 4 years. I decided I'm going to get, I think it's $5,000 a month for 4 years. If it gets to year 5 and I'm still alive, well, then we're going to have to start eating into the 401k and the stuff that I've saved up for my kiddos. But at least I've done that. So it's really something that I have done to protect my estate, if you will, because statistically it's going to happen. Now, your original question, well, let me say this. There's a spectrum of care. So sometimes you can stay at home. There's a number that says 80% of people want to stay at home. We need to have the monies to do that. So you can stay at home. You can have independent living, assisted living, all the way up to nursing home. If you're living in a nursing home, as the name implies, there's healthcare professionals. It's very expensive. So there's a spectrum of care there. And so you want to look at that and get a solution so that you're taken care of. And Medicaid, there's these institutions, there's a level where Medicaid will potentially pay for this, but there's only so many Medicaid beds at a given facility. You no longer choose. So if you go that route and you're covered that way, you don't get to choose necessarily the facility where it is. So I am a proponent of considering this. If you can afford it, get a long-term care policy that will allow you to choose where you're going to get that care. So let me stop there a little bit.
Thank you, Tom. That's a lot of information. That's great information. And yeah, you're right. I mean, as we age, and by the way, it can happen to even somebody younger. It depends on conditions. I mean, someone can be healthy, accidents happen, and now you need some sort of disability, and you're under some sort of disability, and there's so much disability can pay, and therefore you're gonna need some assistance home. And now if you don't have anything, that's the thing. So there's definitely access to policies that can, like to your point, that you design them, you kind of tailor them to what you need, how long you need it for, how much you need it for the coverage. And then basically this, otherwise, to your point, you will wipe up every single savings that you have and tap into it. And then some people go into reverse mortgage, some people go into, they lose everything. So, and again, these nursing homes can be very costly. Again, they're beautiful and some of them have full coverage. I mean, full access to medical. Depends on what you choose. You can have independent or dependent, depending on what the case is. But when you're in those facilities, it costs money. I mean, you're talking about $7,000, $8,000, depends where you are. I mean, I don't think anything cheaper than that exists. But, again, I may be wrong, depends on the state. But the fact is, at least in my area, in the Northeast area, that's the standard pay, $7,000, and that's not including everything. So you got to pay for it. You got to pay for your shampoo and everything else in there, just to give you an example. But so and some of these things can be very nice. But what to your point, the big piece is that some people have beautiful homes and stuff, but their children are not there and they're not going to take time off to be there. And so you need somebody else to be there. So there's 2 hours. You either go to one of those facilities or you stay home, but you have to qualify. And if you don't qualify, let's say to Medicaid, and we'll talk about it shortly, then guess what? You're going to have to pay for it. It's self-pay. That's where it comes in very expensive. Now, Tom, thank you. So the next question is, what would an average policy, for example, month to month, cost someone to design a 4-year or 5-year plan like that?
Well, what I would offer is that's kind of like asking how much insurance cost. It varies when you get it and the size of the policy, but I can kind of put a few data points for you. Mm-hmm. So let's see. And actually, the other challenge for this is there's a couple different ways you can do this. You can actually buy a long-term care policy, or you can actually do life insurance and add a long-term care. So in other words, really, then the question would be then, hey, how much does life insurance cost? And then adding on there. So that's even a harder one to answer. So I'll probably just answer this. I'll answer it in terms of just a long-term care policy. So, and then here's the other one for you. So just like life insurance, you can even add riders. So no, there's one thing to say, I want one now for $7,000. Well, the younger you are, I wonder if that $7,000 is going to be enough for you in 20 years. So there are actually you can increment these policies and say, give me a 1%, a 2%, a 3% inflation rider to help cover that. And so it gets pretty complex, but I will say, I'll tell you mine. So myself and my wife is 2 years younger than me, but she costs more because statistically the ladies are going to use it more. So my policy of 4 years, and I'll say it's 4 years, $5,000. Now, this thing it's bought a couple years ago, and it varies care to care. So it's a challenge, but I want to give you some data. It costs me basically $100 a month. So for $100 a month, I cover myself apparently to the level that I think that's around 4 years. My wife with the same coverage, she's actually $160. She's 2 years younger than me, but I claim that is also statistically because they think they're going to have to pay more. Really, I think the number may be only 2.8 on average. Now, I like to think I'm healthy, and I try to live healthy and exercise it. But my point is, on average, I think guys only last 2.8 years, or they only use it. But I've got it for 4. So the data points I'm sharing is that. But the other thing is, we bought that when we were 50s. I have a family member who I'm shopping at. She's already 65. No, it's $multi-$100. And then I have another family member who didn't want to address it until they're 71. Actually, some of the carriers have a max of 70. You can't even get in there before then. And it's looking at 1,000 and above. So it gets expensive. What I haven't done a lot of quoting of is 40s and 30s, but like I'm saying, it's kind of intuitive. You're paying for it. You have more time to pay for it. And so the earlier you get in, the cheaper it is. But so the data point I gave you a couple on the curve is around $100 for somebody in their 50s for 4 years worth at $5,000 is a data point.
Thank you. So question comes to mind. So if I buy now, let's say as an audience, today, if they decide to purchase a policy today, they'll keep paying for that policy until the point they need it, right? Okay. And then once it becomes active, they no longer pay, or they continue paying.
Well, it can even vary. And in fact, so that now we're getting into there's some complexity. But as a general rule, you can say it'll stop and it'll keep paying. But believe it or not, you can actually turn on care and then turn off again. So that varies policy to policy. In fact, there's even different ways to fund it. That's a thing. I don't know that I want to cover this at this level, but the answer even varies whether you're getting a specific long-term care policy versus going to a life insurance solution and adding the rider, or even they'll call it a hybrid policy that kind of it acts in between them both. So the ways that you fund it and when you do can vary actually. In fact, you can. So that's the thing. I can design certain policies and say, hey, you can start now and you can pay it for 15 years, or you can pay it till you're age 65. There's different ways on when you can actually build it. So the good news is it's flexible. The bad news is it's complicated too. And so that's why we do illustrations. I talk to the person, I tailor it and parameterize it, and it'll generate a 15-page PDF file we can look through, and it'll show the tablet. So you can see when it does and doesn't grow. There's cash value options. And that's the thing. What if you have you can combine these. Let's say I've got a long-term care policy, and then it'll pay 4 years, and then there's a death benefit as well. So they're full-featured solutions.
And by the way, I appreciate the answer because to your point, it was not so much to give us the breakdown, but the idea is that, it will vary. Everything is tailored to your needs. I guess like everything else, you have to know what you need, how you want to, kind of execute on it when you get to that point and when. And then, of course, there's different policies that, the agents can help you with. And again, that's why we have Tom here, is that if you do need to get to that level of detail, he can actually work with you individually and see what your needs are, how you're going to, cut it, what options you have, what carriers, do and when. And then to your point, you can put it into a rider, you can keep it as the primary, you can have one side by side, you can do all kind of things. You can do it where it continuously pays until the end. And so many options. But again, that's the purpose, but know that it is there. It's for you and it's needed. And at a certain point in life, it's going to be needed somehow. To your point, as best as we get older, sometimes walking can become hard. Climbing the steps, can be hard. Showering or taking a bath can be a difficult task. Things that we take for granted today, we don't know until we get to that point. And by the way, there's no such thing as an age, limit. I mean, we consider aging is what gets us there, but again, you can be healthy and get into a problem. So just consider those options. Know it's available. So that's the actual long-term policies. And that's basically a policy you buy in addition, to whatever health coverage you have that compensates for those needs. To your point, Medicare will only give you home care, if you are coming out of hospital rehab and up to a certain amount of hours maximum, and it's only a period of time. And once you're back to whatever your status, that's the end of it. It will not cover more. As a matter of fact, that's under the Part A of Medicare, but again, it is very limited. So don't think it's Part A covers hospital, hospice, home care to a degree, and also like blood, and that's and skilled nursing facility, which is the rehab if you need it, and that's really what it falls. But at the end of the day, those are not your best options when you actually really need real long term. And again, I had a few shows before where we talked actually, Tom, about different methods to kind of finance for these things. So we talk about reverse mortgage with bankers, and they have programs specific. Again, it's very tricky. There's so many ways, because that's the biggest question is like, well, how do I pay for this if I get there? The best way, to your point, is investing in it early on before it's too late, because you get to a point and it's there. There's nothing you can do. The only thing you're going to tap is 401ks, your real estate or whatever you have available to you. And now that's when you actually, now if you have any plans for your heirs, that may be a challenge at that point. so that ties into other questions, maybe trust, and estate, plan and all that. So there's so many things, but buying a policy for yourself, just like buying a life insurance, has merits, depend on what you think. Some people may be for or against it because of whatever reason. Could be religious, could be just moral. I'm not going to care. I don't care about my kids and let them do their own thing. Whatever the case, that's up to you. But know that these are options, and you need to consult. Need to make sure that you know what you're asking, what you want. And sometimes you might not even know what you want until you talk about it. Then you start, oh, I need this. It's like you go to a car dealer, and you start like figuring what you need really, because you don't know what you want in your car. And then they say all these options available. I want it. And again, we're talking health here, not vehicles, but again, it is something that is tailored to your needs and whatever it is. Now today you might think I only need somebody to come in and maybe help me walk out. But then when you get there, things could be worse and you don't know that. So if you plan for the worst, you're always going to be ahead. So again, those are some options. So I wanted to just shed a light on one piece of long-term care. Now, this is not when you buy a policy. We mentioned the duals, people who have Medicaid. We mentioned duals with Medicaid. But if you had just Medicaid, that's one piece. And you have programs that actually do offer, home care type, long-term care plans that are available under the managed care industry or HMOs, and they do have plans that are specific where they give you a home attendant, you can go to adult daycare, and you can get equipment, you can get your what do you call them, the purse, those press button, responsive, exactly, personal responses, and then you can also get some amenities added to your facility, to your home, with again whether it's bars or ramps for your wheelchair, DMEs, things like that. So those plans do offer if you actually qualify under the Medicaid. If you have Medicare and Medicaid, there's plans that integrate both, so you can actually have all that under one roof, and those are like what we refer to as Medicaid Advantage Plus, MAPS. So you have these options, and then of course, you have the self-pay. But if we were to consider Medicaid versus no Medicaid, the majority of the folks may not have Medicaid, and therefore that's where you actually 90% of the population or 80% plus will fall, and therefore you need to be aware that you need to do something about it now before it's too late. And I love what you said. This is not something you plan when you're 71 or past 65. You want to plan ahead because it's just a matter of time. Now, I know you mentioned something about a male versus a female in terms of what the statistics are, and that's just what insurance, there's the statistics and things and trends, and they look at who needs what and where. And again, this is not about a gender, it's just about real statistics. Just like with driving, we have age groups and they have different driving statistics. The same thing here. Health varies from one person to the other, one age group to the other, and one gender to the other. So there's always that. So again, so great coverage for a lot of stuff we covered today. So is there anything else that we missed actually under these types of policies that you offer?
I don't know if we missed anything. I just want to reiterate something. I think that most people on the street know at least a little bit about life insurance. They understand what a premium is, and they understand, even though they might not call it the face value, they know about that, and they understand the need because they understand their own mortality. I think that long-term care is actually something that isn't understood. They don't think they know what it is, and they just don't think about it. But I'm telling you, so it's relatively new. So I am passionate. So you kind of said something, and I'm just reiterating that it's like life insurance, and I think it's something you should consider. So I think everybody should. In other words, I think everybody should at least shop life insurance. I'm not telling you go and buy some right now, but at least go and shop some life insurance. Maybe consider how much do you need in your personal circumstance, because I don't want you to leave a spouse with a big mortgage, or if you have a bunch of kids and they're not be able to go to college because you died sooner than you thought you were going to pay for that. It's similarly long-term care, because that's the thing that what I don't have the stat is on bankruptcy and health concerns. But no, a lot of people go bankrupt because these big health issues hit them, and it eats into the money they've saved. So I'd hate for your listener to have done good in investing and saving and working hard, and they have a nice nest egg built up for their retirement and or their kids, only for that to be consumed. And they live and watch that too. So my message is, please do at least shop and consider long-term care policy, because it's statistically 75% likely you're going to need.
Thank you, Tom. One thing, I know we talked disability briefly. Do you sell any disability policies as well, or?
I have some limit. I have limited options. Yes, I can't. I do that. So I'm conversant. I can talk to it. It's not a big piece of my portfolio, but I do have disability short-term and long-term policies that I can offer for people. So
again, these are all peace of mind policies. I mean, if you can't afford them, there's no reason. There's a good way. It's a possibility, so you can do that. And to your point, see the value for you, see if it makes sense, and you got to do it. I mean, if there's any risk, that, by the way, we all know that is imminent. I mean, it's just a matter of when. I mean, there's one thing certain in life, so that's why life policies are, and people do always worry about their kins and family members and heirs, and they want to have something. To your point, you work hard and everything, and then all of a sudden everything is gone because your demise is early, and that's a problem. But nobody knows when that happens, and that's the part of life that we cannot control. And then of course some things are predictable. We know that if you age, you're going to have a need, or some needs to have assistance. Now, your grandkids may help you, but that's not always the case. And again, we live in a society today that's lesser and lesser to happen, where your grandkids or your kids are going to be really taking your hands and holding you and taking you out and then bringing you. And unfortunately, our society is getting to that total independence where, people leave the nest and they don't come back. They come and visit on the holidays, and that's it. I mean, we can talk culturally about all that, but that's a whole different world. But unfortunately, it's reality, and we have to face it. And unless you have a plan, like everything else in life, you want a vacation, you put a plan together, you save money, you do whatever, and now you have money to enjoy your life. Same thing here. We get to an age, if we get there, you want to have it. Now question, what happens if someone passes on before they ever use the policy? So is that money gone? Great
questions. Those kind of vary. Some that's examples we got to look at. So sometimes there are some that have. That's the thing. Long-term care used to have a bad rap, just like life insurance. In other words, over time, the industry's gotten complex and responded to needs. So back in the day, life insurance, I guess there was never instance where no one didn't die. But, there's certain things where people didn't like contributing. Oh, how about this? No, a 30-year term. In other words, you buy a 30-year term when you're 26 years old and you live to be 80. Well, you paid all that time on it and you didn't get that policy because it ended, particularly if you didn't. So there are some financial scenarios where it's not good. And so traditional long-term care policy used to be that way as well. So potentially there was a scenario, at least on some policies, where you would pay that and then you died, you never have it. Well, at least now sometimes there's either a return of premium where you'll at least get the money back to get better, or there is a death benefit. And so there are some, they've responded to the market. And so they are more full featured now. So long-term care is more full featured. And so typically you're going to get something out of it, right? And I'm a proponent of that, doing the return of premium value or a death benefit, and or that thing. If you do, another thing is if you do the life insurance policy, that's just a rider. Well, then in theory, you only missed out on the rider. So there's different ways to do that, but it's a great question and something to consider.
Well, definitely. And again, I know someone will be like, well, what's happening to all my money if I never need to use it or whatever happens? Or the spouse say, well, he never used it. Or she never used it. What's up? So again, folks, know that there's options. Again, these are things that you have to ask and consider. And yeah, it is your money. It's your investment. You want to see what that looks like if you never used. It's like we know this. Unfortunately, you buy a lot of things and sometimes you don't use them. I mean, even from home, you buy one of those policies that covers your appliances or whatever. But if you never use it, you go to an electronics store and they sell you a policy for, 2 years, 3 years warranty. You never use it. That's, what happens. It's gone. But this is something that is a long-term investment, more costly. So you do want to make sure that you have options. Again, depends on the policy. There's always the pros and cons to everything. You just have to ask the right questions. Make sure you read everything and make sure you get somebody that's trustworthy. So Tom, we talked about that. We are licensed people. So therefore, we're supposed to actually, follow the rules and regulations. It's heavily regulated as an industry. And, obviously that doesn't mean that there's not people out there that do bad things, but the majority always we're looking forward to do the right thing to help you. It doesn't pay to actually do bad things because eventually these people are no longer operational because the states and then the federal agencies can actually crack on their license and take it away, and they can lose their living, and simple as that, because they just did not, take care of you. So we want to make sure that everybody that watches and listens, you want to be feeling good, comfortable that if you talk to an agent, you're talking to someone that is licensed and they basically know what they're doing. But then shop around, but now we have Tom with us, and, again, Tom is back. And as you can see, we had a great, exchange here today. Again, we covered a lot of grounds. Now, one thing we didn't, tell the folks today is your service area, because I know you cover multiple states. If you don't mind, can you just reiterate where those states are?
So approximately a southern band along the U.S. It's Washington State. I actually haven't done Oregon. I'm probably going to do that. California, Arizona, New Mexico, Texas, Oklahoma, and then Georgia and Florida. So really, and that's saying an insurance agent can get appointed in another state, but those are the ones that I'm in currently. If I have the need to help other people, then I'll go and get a reciprocal non-resident license. But really, those right now, it's a southern band, and I do that partially because I speak Spanish, and so a lot of Spanish speaking population. But that's who they are, kind of the southern band of the U.S. Although it kind of curls around and goes up towards Washington State.
Well, you cover a nice little surface there. So, hey, listen, it's great stuff. And to your point, agents can cover up to 50 states literally. So depends on where you are. But to your point, it's not easy. It's not hard for us to actually switch states. You just kind of apply. It's online. It takes a couple of minutes. You pay and you actually alive in a different state where you can actually, represent those policies in there and be able to do them. Then you certify for those local carriers and it's done. So again, the reason I asked is obviously we want to, folks, you're watching, you're listening. If you have any questions, we want you to reach out to Tom and ask questions. If he can help you, he will be more than happy to do so. If you're in those territories or these service areas that he mentioned, well, guess what? You have access to him direct. If not, he can either help you by making himself available to you in a different state, or I'm sure he has collaboration with other agents in other states, and that certainly can work. And if you want somebody in New York and in Jersey, you can call me and I can line you up with people as well. So we have you covered. It doesn't matter where you are. If you are from a different country and you listen to the show, at least you learn some tricks about how the business works here and the insurance and different options. It may be similar in your country. Or if you're thinking to come in here, whatever your family here, this could be something helpful for you. And or if you're putting policy in there, maybe you can use some of these points and put it together there. Whatever the case may be, this could be for you. If it's not educational, it's definitely something you can use. Tom, any last words to close our show today?
No, thanks very much for your time. I'm glad to be on again. I do request, for one, to your point, it's all about helping people. So I know you and/or will answer questions too. No, someone doesn't even necessarily need to be shopping for policy. They just want to know something. We'll reach out to, because we know that if we provide some good information, well, then they're going to refer and let someone know. So either Hurricane or I are willing to answer questions. My name is Tom Basey. The company's Basey Insurance. Please do connect with me on whatever your preferred social media channels. I'm on most of them. So find me there and connect. That's all I got.
Tom, thank you. And I'll have your link again, as usual, on the description of the show, so people can link up to you direct. And as for me and as for now, folks, thank you for being with us, for watching. Hope you enjoyed this show. We'll be talking soon. New day, new show, and potentially different guests this time. Take it easy. Bye-bye.
Okay, thank you. Bye.